Meet Jane, mom, wife, and former accountant. Jane and her husband Sean are looking forward to their son Kyle's birthday as he is turning 12 this month. However, this year is different. This is the first birthday that Kyle will be in a wheelchair.
Looking back on his early childhood, as a young toddler, Kyle was extremely active. He would run and play with his friends, only stopping when the playdate ended. But things changed with time. At age 5, Jane noticed something was different with Kyle. He frequently needed breaks from activities such as tag or hopscotch, and he didn't have the same stamina as his friends.
The changes extended beyond physical capabilities. Kyle's preschool teacher noted some cognitive impairment. She brought this up to Kyle's mother, stating that she noticed how Kyle struggled to master concepts that the other students had no difficulty with. She advised extra tutoring or potentially even a counseling consultation. This wasn't easy to hear, but Kyle's mother appreciated the caring sentiment behind it. She told his teacher that she understood and thanked her for letting her know.
Feeling concerned, Jane made an appointment with Kyle's primary physician. She discovered that Kyle had Duchenne muscular dystrophy, a very rare disorder with no cure. She was also told that nothing could be done. The clarity that Jane sought was not found. She knew what Kyle had, but she did not understand what this entailed.
Her thoughts were racing. She wondered if there was something she could have done during her pregnancy to prevent this. Is this something she did wrong? Would her insurance cover this? How will her and Sean pay for treatment? How would she explain this to Kyle? He's only 5 years old and he won't understand. One thing Jane knew for sure is that she had to break the news to her husband.
Jane, what do you mean there is nothing we can do?
That is what the doctor told me, Sean.
He's sick. I don't understand how there isn't anything we can do.
I don't understand what you expect me to do, Sean.
Because of her bad experience with Kyle's primary physician, she avoids going back for quite some time, and they never reached out after giving the diagnosis. As Kyle progressively gets worse, Jane decides to take matters into her own hands. She finds platforms designed to guide parents of children with DMD.
With time and research, it became clear to Jane that while there's no cure, there are several ways to aid a child with DMD. Kyle turned 12 and celebrated his birthday with his closest friends. While his birthday was different than any he had before, he still had an amazing time.
Since his diagnosis, Jane has been the primary caretaker of Kyle as his disease progressed. She has had to give up her job as an accountant and schedules her days around Kyle's needs. The struggles of being Kyle's primary caretaker has started to impact her emotional well-being. She's overwhelmed, tired, and feels guilty for feeling this way, questioning if she is a terrible mother.
Jane is not alone. Caregiver burden is something that all guardians of DMD patients must endure. Many qualitative studies have been done to collect reflections from parents who have children with DMD. The quotes in the following slides reflect the real experiences of parents and the struggles that they face. One mother said, "I must get up early to bring him breakfast, clean his teeth, and comb his hair. My daily schedule is closely related to him and depends on him. Everyday life is so tiring." As a child's DMD progresses, the caregiver must take a more hands-on role in the child's life. The parent's schedule becomes tied in with the child, be it for doctor appointments, school field trips, or anything else.
One parent says, "I just care for my child the whole day and sometimes become disturbed as I cannot find time to do everything. Life is no longer joyful." Although the parents care deeply about their child, the stress it puts on them can be overwhelming, and they might find that they might have little time left over for their own time commitments. This can be incredibly difficult for a parent, and some have to seek psychological treatment.
Another mother said that the person at the front counter told us it was DMD, but she didn't know what DMD stood for. There was nobody to contact besides the pediatrician. This ties into the theme of physicians not fully explaining the diagnosis, which is harmful for many parents who may not understand the severity of the disease or what the next steps should be, leaving many parents to feel as though they are left in the dark after receiving this diagnosis.
A father said, "She must stay at home. I can escape because I must go out for work and other stuff. Staying at home could be bad for my health. I cannot focus on my work. I used to be much better. Things are not well with me." The burden of one spouse having to stay at home while the other must work is something commonly faced by DMD caregivers.
Another parent says, "We become isolated and we do not visit our relatives ever. We must always be available for the child." Because they need to care for their child, parents often become isolated and unable to spend time with the rest of their family. It can be stressful to not have this family time, but the parents know that they need to be available if their child needs them.
Lastly, another father said, "Sometimes I feel anxious in my work. I think about whether all things are going well or not. I had many projects in my business, but unfortunately, I postponed most of them. I'm overwhelmed in my home environment." This just goes to show that even the parent who doesn't stay home with the child is constantly thinking about the diagnosis. In a qualitative study that was done, 4 themes regarding the diagnostic process emerged based on all the parents' experiences that they collected. Many felt that the physicians were extremely dismissive of their concerns, prolonging the period between when they noticed symptoms and when they actually received a diagnosis for their child. Many parents also felt as though they had limited knowledge on the disease and misunderstood many clinical signs or recommended screenings and testings. Many parents also felt as though the diagnosis was carelessly delivered, which leads into the last theme of a lack of guidance post-diagnosis. Parents described that there was little follow-up after the DMD diagnosis, which is similar to what we see here in Jane's experience.
However stressful the burden may be, parents can find a way to push forward while taking care of their child. Parents develop strategies to help them cope with a stressful situation. Some push forward one day at a time. Others try to help their child live as normal a life as possible, encouraging them to make friends and take up hobbies. Others, like Jane, try to take a proactive role in their child's care and make it their goal to do the best they can to slow the disease. And then lastly, others become advocates for disability and find the personal strength to speak up for others.
Though parents face significant emotional challenges, coping mechanisms are an effective way to provide support and hopefully a way to improve both their quality of life and the quality of life that they can provide for their children. I hope this presentation was insightful and thank you for listening.